I'm Tony DeCopo here at the fourth annual Women in the World Summit in the Toyota Solutions studio with Christy Turlington, one of the more recognizable faces in the world, longtime model for Calvin Klein and many other brands. More recently turned to advocating on behalf of maternal health, the founder of Every Mother Counts, and a panelist here at the summit. Can you begin by just giving us a sense of how big the problem is when it comes to maternal health?
Well, I became an advocate when I became a mom myself 9 years ago, and I suffered a childbirth-related complication that I learned soon after was the leading cause of maternal death in the world, and that at
Wow.
that time, 500,000 plus women were dying each and every year from pregnancy and childbirth-related complications. That number has come down significantly since 2003 when I became a mom, but it's still just a little bit below 300,000 women, and most of those deaths are preventable, which is what I think is the hopeful message about this issue.
Uh, so the drop. I mean, what do you attribute that to? What happened? And
Well, it's taken some time. I mean, it's taken a number of activists and public health workers to really be focusing on this issue. And I think from conferences like Cairo and Beijing, where women's status and women's rights as human rights, that message got elevated, I think that's a big part of why those numbers have come down. It just has taken some time to get them down there. The other thing is that we're counting women and girls in a different way than we have
Mhm.
previously because they've become higher up on the agenda. Countries are paying attention. The MDG certainly has made an impact, even though maternal health is the one that's lagging behind the other MDGs most significantly. And today is the very end count off, I think 1,000 days in before we finish the Millennium Development Goal. That all helps. That elevated awareness, the political will increases, and then that sort of trickles down to the grassroots where real action happens.
Mhm. And a country where action is definitely happening is in Malawi, right? Can you tell us a bit about the situation on the ground there?
Well, it's a country that people are very hopeful. It's one of the poorest, the bottom 10 in sub-Saharan Africa, and yet it has this opportunity because they have this very engaged president. Dr. Joyce Banda is now the president of Malawi, and she has long been a huge proponent of maternal health and women and girls. And so having someone in that seat at this point in time with the knowledge and the support really from around the world to
Mhm.
help her stay in that position of power, that just is an incredible opportunity to make a huge difference. So it's a country like other places in sub-Saharan Africa where distance is a huge factor, and most women live far away from cities and hospitals that can handle emergency obstetric care. And so she's sort of building a bit of an infrastructure to be able to make that access more
Just
obvious for more
yeah.
people.
So there's not a technological solution here. It's more a matter of awareness and then finances.
I mean, I would say there's certainly a financing mechanism that should be into place, but there isn't one at the moment. And because economies are sort of fighting for dollars in a way that is unprecedented at the moment, it's a little bit hard. But there is goodwill. There are proven solutions like training midwives and other mid-level providers,
Mhm.
community health workers that we know will make a huge difference, providing maternity waiting homes closer to cities and facilities so that women don't have to travel those distances. Those are things that they're certainly they take money, but they don't cost as much as you know trying to create a cure for a disease.
Mhm.
Pregnancy is a very natural physiological process. It's
Yeah.
just for 15% or so of all pregnancies that could result in a complication, and being able to address those in advance is the way to prevent needless deaths.
I mean, 15% is a big number, and it's appalling that in the 21st century we wouldn't have figured out a way to get that number lower and put the necessary safety precautions in place. And you were saying earlier this is not only a problem in poor countries; it's a problem in America as well.
Yes, according to Amnesty International, who did a big study a few years ago called the Deadly Deliveries Report, the U.S. is ranked 50th, and we've actually dropped in the last 10 years as opposed to gotten better. And it's surprising for people where we do spend more on health care per capita than any other place in the world, and certainly there's no shortage of hospitals. However, there are a number of women, because of their insurance coverage or lack thereof, that have fallen through the cracks. And we we have similar reasons for the cause of death, but there are other ones too. Advanced maternal age here is becoming a contributing factor, the rise in obesity, chronic illness such as diabetes. Those are all things that are contributing to these numbers on the rise.
Wow, so the problem changes as societies evolve.
Yeah, they change to, it's slightly different. It just changes the direction.
Fascinating. Can you tell us a bit about what you've enjoyed here at the summit?
Gosh, I think each panel has been riveting in its own way, but I would say that the last one that we just came out of with Dr. Trent and Oprah Winfrey was pretty remarkable.
Absolutely.
I think Dr. Trent, I'm familiar with her story through Half the Sky, but hearing her in her own words talk about her experience of being an 11-year-old who was married off at that age, which makes maternal mortality a lot more likely in so many of these stories, and then that she was a mother of 3 by the age of 18 before she even had an opportunity to continue her education. I mean, it's just incredible what she's achieved.
Wow.
Post becoming a mother, post becoming, surviving those atrocities.
Wow. Well, thank you for joining us here. Christy Turlington, the founder of Every Mother Counts, and a panelist here at the Women in the World Summit. Thank you very much.
Thank you.